time for another Ask Dr. Vaughan Periscope. Let me turn the camera around and we will see what you guys are saying. Something unique about this Periscope, I've never done this before. This one only allows for chat from people that I follow, which is everybody who follows me plus a few. And so the only way that you can follow me and not be able to chat is if you just signed up. Hey, Cy Fox, good day. Thanks for joining us. Mike Sheehan, thank you for inviting people to join us. And Shannon Gruskutz, thank you. And forgive me on the pronunciation of names, as it's really small print and my phone screen is small. So if I don't quite pronounce your names correctly. One, Kurt, thanks for joining us. You're a familiar name. And thank you for the hearts, by the way, whoever that is. We really appreciate it. Somebody who's green, and that could be one Kurt or Eve or both. Or Shannon. Actually, it's Shannon. Thank you, Shannon Gruskutz. Is that close? I'll keep trying. Alyssa, thank you for joining us. This is Cy Fox Media. Thank you for inviting a couple of people. This is a chance for you guys to go ahead and ask questions. I don't have any agenda, although I can talk about what happened recently. Yesterday we had quite a talk about physician-assisted suicide in California. It was coming up before a assembly committee. And oh, Holland, thank you for joining us. And we were able to not even have to defeat it because the author withdrew it. So good news there. How do one get rid of skin tags? Well, in our office, we will spray them with liquid nitrogen right at the base to cause frostbite and then let it thaw out and then do it again. And then they'll fall off within a couple of days. Hey, LA, thanks for joining us. Pronounce Grosskreutz. Grosskreutz. Did I get it right? Grosskreutz? Another way it can be done is by, or that we use, is to numb up with an injection of some local anesthetic right under the skin tag and then shave it off level with the skin. Empire City Ray, hello. And Chelsea from the UK, hi, with the thumbs up, thank you. How good is vitamin C in serum for the skin? You need vitamin C, and most people get it through diet just fine. No, but that's okay. Grosskreutz. It seemed like that's what I was. I'll keep working on it though. I'll have to watch your Periscope and see how you pronounce it. That'll work. Am I familiar with lupus? We are familiar with lupus. Lupus erythematosus, systemic lupus erythematosus. Oftentimes we refer to it by its initials SLE. And it is a rheumatic disease, meaning that it's a part of the body's immune system turning on the body itself. So you have antibodies against your own structure of your body, and it causes horrible symptoms, which can include rash and pain and arthritis and other things like, off the top of my head, I can't list the whole thing. I'd actually have to go to the textbook to give all the things it can do. Oftentimes treated with strong medicines that decrease your body's immunity, like prednisone or other immune modulators. Hey, Holly, thank you for joining us. In Empire City, I guess you know Holly, so yeah. Hi, guys. So that was good news about not having to fight the physician-assisted suicide in California, at least for the next year, unless they bring it back. Would you be okay sharing your views on medical cannabis? I do that quite often. I don't feel that cannabis really provides anything we don't otherwise get from medicines that we have. Big Red, hey, thanks. Thanks for joining us. Hi. Were your pep? Oh, thank you, Empire City. Walking to the pool now. Weather's been cloudy so far here in Cali. Yeah, it's cloudy here too in Northern California. No, medical marijuana. I don't feel like it has such a unique benefit that other medicines don't already have. It's usually kind of weak as far as what benefits it does have for different things. The use of it, smoking is very dangerous, as dangerous or more dangerous than cigarette smoking, so I don't recommend smoking it. That leaves you with eating it. I do find that with many people who use it, when I tell them to eat it instead, they don't like that because they like how it makes them feel when they smoke it. So that's true for a lot of people. So overall, I'm not for it, and I don't write for the green cards. That's what we call them in California, the cards that we write for the prescription to use medical cannabis in California. Husband sweats successfully at night, like stains the sheets. Should he talk to his doc? Possibly. Usually, this is not something that's terribly unusual, and a lot of times the staining of the sheets is not so much from the sweating, it's from the skin oils, from really oily people. They'll get the stained sheets. And you can tell because the smell is, well, if you know the smells, the smell of the pillow or the sheets is more of an oily smell, not so much a sweaty person smell. The 6th lane, yes, you're welcome. If it is sweating, though, it's not too unusual for people to have variations of temperature and to sweat at night and have to have much less covering on their bed than they need, what feels comfortable when they go to bed, and they have to have less later on in the night. And the body does change because of its thermoregulation. The low point is in the evening or in the middle of the night. And so you can feel hot very easily with a sheet or cover or bedspread being on you. I would say first just give a try to having one less cover on the bed, or take off the heavy one and see how it goes before feeling that you have to go see the doctor to get checked out. Echocardiogram revealed a PFO heart defect. PFO, patent foramen ovale. Somebody has a patent foramen ovale out there. This is a hole in the heart between the ventricles. Foramen ovale. Boy, you're really taking me back to my basic anatomy. That allows blood to go from the right side of circulation to the left side, which is a big deal because that means it's bypassing the lungs where carbon dioxide gets blown off and oxygen gets brought in. So it can cause a real problem, especially if the blood is going in the wrong direction on it. And there's actually ways to modify that, and it can change from time to time. Oftentimes will just be repaired with, which sounds like a big deal, heart surgery, open heart surgery, but actually as far as open heart surgeries go, this one is not as serious as a lot of the other ones, done by, of course, a cardiothoracic surgeon, a specialist who does just operations on organs within the chest. But not all of them have to be operated on. For somebody to be writing that here on Periscope makes me think that you're already an adult or pretty mature teenager. Could anything be wrong hormonally with sweating in men at night? Yeah, it can be. You want to check thyroid levels on that. Is enlarged heart dangerous? Can be, yes. For the heart to be enlarged means that something is wrong. It's not normal for it to be enlarged. It may not be so much that the heart being enlarged is the problem, is what's causing it. Some pressure, that gradient that's pumping against, caused possibly by a uncontrolled hypertension or a valvular problem, or if it's the right side of the heart, increased pressure in the right heart circulation, meaning the lungs have a great pressure. We see the starts of this in people who have sleep apnea. They'll actually have increased pressure in the lungs, and it will cause right-sided heart pressure. Funny thing about it, the treatment for sleep apnea, as far as I know, has not been shown to decrease the problem with the pressure on the right side of the heart. That the medical terminology for that is cor pulmonale. Cor referring to the heart, pulmonale referring to the lungs. So if you guys have anything else, great. If not, it's actually time for me to do something, but I can hang on for a little bit. For proctitis, over the counter for proctitis, not so much over the counter. You'd actually want to get a steroid cream that requires you to have a prescription. And of course, you want to get the proctitis checked out by a doctor anyway, because sometimes that can be a problem that a doctor can help treat. It can come from a number of things: constipation, infection, fissures, which are little vertical slit openings in the actual channel as it goes through the anus. So a number of things that you want to get checked. And of course, we always think of, is it possibly related to colorectal cancer, which you want to be updated on your screening for that. Yes, we are glad, Alyssa, that you enjoy it and find it informative. Love having you guys here. This was our very first Periscope with only people I follow being able to comment. So if you want to be able to comment, then you have to follow me, and then I in turn follow you, and then you can comment. Oh yes, you're very well. Did the death bill pass? No, thank you for asking. In committee, whoever was the author actually withdrew it. So they never even voted on it in the committee, which I made a Twitter that said it was defeated. Not so much defeated as it just wasn't continued. Yes, you guys are very welcome. And I will go ahead and sign off for now. I look forward to being with you guys next time. Again, if you haven't already, swipe right to follow or to share with your friends. And I so much appreciate those of you who do follow and share with your friends. And of course, that's all of you guys who are writing, because you have to follow to be able to write today. All right. Yes, thank you. And I look forward to the next time I have some time with you. Until then, thank you for the hearts too. This is Dr. Mark Vaughan telling you to stay in good health.